Dear viewers, I hope you are all fine. This ultrasound video shows a case of gestation sac in the uterus without any fetal pole in it, that is incomplete abortion. The duration of pregnancy is about slightly more than 7 weeks. You can see the gestation sac, urinary bladder, uterus, and the gestation sac is empty. There is no fetal pole. There is no embryo, fetus, or umbilical vesicle visible in this gestation sac. So, and the pregnancy measures about 7 weeks, 2 days. So, this is a case of incomplete abortion. However, if you have a follow-up ultrasound and there is still no sign of fetal pole, that is a gestation sac which looks like with white rim around a clear center, a miscarriage has likely occurred. In some cases, the empty gestation sac can remain intact for a number of weeks before miscarriage symptoms appear. Again, you can see the empty gestation sac. If there are no signs of pregnancy or inconsistent signs like a large gestation sac without any yolk sac or fetal pole, it may mean that you have a blighted ovum or otherwise miscarriage. This is very common in earliest weeks of pregnancy when the risk is highest. Incomplete abortion is a pregnancy that is associated with vaginal bleeding, dilatation of the cervical canal, and passage of products of conception. But an ultrasound doesn't immediately show that woman might expect. It is typically not until a woman in 6 weeks pregnant that any part of the fetus is visible, which allows the doctor to determine whether a pregnancy will be viable. Now, the signs of incomplete miscarriage are heavy bleeding. Get medical help if you are soaking through a pad in 1 hour. Bleeding that occurs on and doesn't settle down. Passing blood clots, then increasing tummy pain, which may feel like cramps or contractions. Then there is a raised temperature, fever, and flu-like symptoms. So the complete abortion is when all of the products, that is tissue of conception, leave the body. Incomplete abortion is only some of the products of conception leave the body. Inevitable abortion is that symptoms cannot be stopped and a miscarriage will happen. Miscarriage abortion mostly happens because the fertilized egg in the uterus doesn't develop normally. Stress, exercise, or sex doesn't cause a miscarriage. While many miscarriages pass on their own, some do not. They are called incomplete miscarriages because all of the tissue related to pregnancy is not shed from the uterus. Often some of the pregnancy tissue remains in the uterus after a miscarriage. If it is not removed by scrubbing the uterus with a curettage, you may bleed for a long time or develop an infection. While abortion is happening, the cervix dilates wider than normal. While the cervix is more open, the uterus is more prone to infection. This is why doctors recommend waiting at least 2 weeks after miscarriage to insert anything into the vagina, including tampons, douches, and yes, anything else that may penetrate. Infection after abortion, symptoms of fever of under 0.4 Fahrenheit, that is 38 centigrade, or higher, pain and belly tenderness will usually start within 2 to 3 days of the procedure. Thanks for watching. Please subscribe my channel. If you do like this video, please click the like button. Thanks.